So, the contraceptive pill, very convenient, wonderful invention that came along in the 1960s. Women were told that they had now got the secret to foolproof contraception. Awesome. Yes, sign me up. Thank you very much. What they weren't told is that the one trial done on the contraceptive pill had been done with 130 women for a very short period of time. The only focus being, does it stop you falling pregnant? There was absolutely no write-up of any form around the side effects that these women may have been experiencing at the time. And no other trials were done. No trials to look at the long-term effects of halting ovulation with a synthetic chemical. So what we know today is there are many, many side effects, some of them deadly. And yet, the contraceptive pill is still handed out over the counter like a packet of Smarties. So, firstly, if your doctor prescribes a contraceptive pill for you, have they told you that you should not be on this for more than 10 years? Have they done a thorough check of breast cancer history in your family? And have they done a thorough check of psychiatric history within your lifetime and within your family? Because those are absolutes. There is no question that those have to be covered before a doctor can even contemplate mentioning any form of hormonal contraceptive. So what we've been seeing since the 1960s is a lot of very common symptoms such as weight gain, water retention, insomnia, anxiety has been a big one, sensitivity to thrush and other kinds of microbiome disturbances, sensitivity to HPV. Women's pap smears are coming back with much higher levels of HPV than if they're not on the contraceptive pill. And also seeing that it drops the libido. Yep, it does. It also actually can lead to vaginal dryness. And when you look at the clitoris and the erogenous tissue in the vagina, it's actually shrunk. The ovaries actually shrink while you're on the contraceptive pill. So it affects our ability to have really good sex and really good orgasms. And it can even thin the tissue in the vagina. So just with that, there's already not the greatest foundation for staying on something for a long period of time, but far more serious symptoms have been seen. So what we need to understand is that the contraceptive pill is not a hormone. It does not contain any hormones. It contains chemicals, pharmaceutical drugs that are designed to stop ovulation. So they go and they sit in the receptors for your progesterone and your estrogen and your testosterone, and they stop your body from being able to receive real hormones and halt the whole reproductive cycle. So stasis, you are now held in cryostasis. No ovulation, no reproductive cycle, no real menstruation. You have a pill bleed, but that's not menstruation. Menstruation is a hormonal process. So while you're in this state of cryostasis, your body is being dramatically depleted from essential nutrients needed for healthy hormones, such as vitamin C, your vitamin Bs, including folate, magnesium, zinc, selenium. All of these are needed for really healthy ovaries, healthy reproductive cycle, healthy adrenals, healthy thyroid, healthy pituitary gland, whole endocrine system. So it doesn't just affect your ability to fall pregnant. It's affecting your entire state of well-being. When you don't ovulate, you don't produce progesterone, and if you don't produce progesterone, you are lacking your vitality hormone. Progesterone has over 100 essential jobs in your body. It is a steroid hormone. It's not just for making babies. It helps keep your brain chemistry balanced. It's the precursor to GABA, the anti-anxiety neurotransmitter in your brain. It makes cortisol so that you can handle stress. It soothes the nervous system by helping create the myelin sheath along your nerves, so it calms down your entire nervous system. It's involved in creating bone density. It's not about the calcium. It's not about doing lots of yoga. It's about having ovulation. Ovulation creates bone density. That's what prevents you from getting osteoporosis when you're older. So without your progesterone, you are creating a lot of long-term health risks. But on top of that, the progestin, the synthetic chemical that's in your contraceptive pill, is actually now creating a lot of other problems on top of that. So it's dramatically increasing your risk of blood clots. What does that mean? That means thrombosis, that means strokes. Yes, you have 20-year-old women that have died from strokes from the contraceptive pill. Died. Sorry to be dramatic, but it's true. People have died from the contraceptive pill. Many, 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 many women over the last couple of decades, or since the 1960s. It really increases your chances of depression, which is only really starting to be documented recently in science, but thankfully there's quite a lot of papers now. And again, your doctor needs to be very clear that it can increase your chances of light depression or even clinical depression. Women have become suicidal from the contraceptive pill. So that's quite a biggie. It also increases your chances of autoimmune disease for many reasons, because of the lack of progesterone and because of your microbiome being suppressed, and just the nature of the chemical in the contraceptive pill. And it also increases chances of breast cancer. Yeah, it's a biggie. It's a really, 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 really big one. And this is the reason why you're supposed to come off it after maximum 10 years, because after that it increases your chances for everybody. But for those that have a genetic predisposition, it increases your chances of breast cancer from very early on. So I look at the breast cancer situation in the world today, and I really think the contraceptive pill is one of the main fuels that feed that fire. This is not a drug to be taken lightly. And interestingly, it's not even as foolproof when it comes to contraception as you're told. It's only really, really effective if you take it exactly the same time every day. You never have diarrhea, you never vomit, you don't drink alcohol, you don't take recreational drugs, and you basically just stay in a static health state all the time. When there's any changes in your health, then it affects the effectiveness of the contraceptive pill. So there's many, many babies out there that have been conceived while women have been on the contraceptive pill. And there are many other forms of contraception really worth looking at, and I'll share a video on that another time. But right now I also want you to understand that the Mirena and the injection and the patch, they are all the same drugs as in the contraceptive pill. The Mirena, yes, it's a lower dose, but it's released directly into your uterus, and that in itself is highly concerning. So most women on the Mirena will see changes in health in their cervix, within the first 2 years and within the health of their ovaries. So, yeah, they all have the same side effects as the contraceptive pill in slightly different expressions over slightly different periods of time, but these are not real hormones. They do not regulate your hormones in any way, shape, or form. Cannot regulate them. They are stopping your hormone production and replacing them with a pharmaceutical drug that sits in the hormone receptors and does not do any of the tasks that your real hormones do. That does not work in a healthy way in your hormonal system. Okay, sorry for the doomsayer news, but this is why I do not promote the contraceptive pill in any way, shape, or form. And if you are dealing with reproductive problems, please know that any of these reproductive issues can be approached and healed through natural means. And there's obviously quite an array of things going on out there, but I created the Hormone Wisdom course online so that you can take your time in going through all the major sections that exist. I'm constantly updating it. It's something that you can access at any point of time for a lifetime. So know that I'm probably going to be updating the information as I learn new things every month. I'm constantly researching. And it really covers the full foundational spectrum of everything that every woman really needs to know about their hormonal health, why things are the way they are, and what are the natural tools that really work. So blessings on your journey, beautiful people, and know that post-pill syndrome is a real thing and that it can be healed with the right support.